Welcome back. May is Stroke Awareness Month. According to experts, early in the pandemic, there were considerably less patients seeking care for strokes of all kinds, severe and mild. Joining us now to share why catching strokes early is important, even in a pandemic and more, is Dr. Daniel Labovitz, Chief of the Division of Vascular Neurology at Montefiore Medical Center, Albert Einstein College of Medicine. Welcome, Doctor. Thank you so much for joining us today.
Thank you. I'm honored to be here, and I think we have an important message today. I'm delighted to be with you.
We absolutely do, and we thank you. First, Doctor, let's start with the basics. It is Stroke Awareness Month, as we mentioned. Can you help us define what a stroke is exactly?
Yeah, that's a great place to start. What is a stroke?
Mm-hmm.
So people have heard of heart attacks. That's where you get a blockage in an artery in the heart, and the heart hurts and fails. Stroke is similar. It's a blockage in a blood vessel in the head, but it's also more complicated because it's not just a blockage in a blood vessel in the head. Some strokes are caused by bursting of a blood vessel in the head. So you can have stroke from a blockage that causes lack of blood flow, or you can have stroke from bursting of a blood vessel, and that causes bleeding. So I like to say my job is much harder than that of a cardiologist who just worries about blockages.
Shots fired at cardiologist, Doctor.
Let's get started.
What are the main risk factors for stroke, Doctor? Let's say someone is listening and they're concerned about possibly getting a stroke. What are some of those main risk factors that we should watch out for?
Yes, so everybody needs to know, and it may not be about you yourself. It might be about somebody who's sitting next to you or your mom, or so everybody knows, no matter how old they are, what the signs and symptoms of stroke are.
Mm-hmm.
So the number one symptom that we see is weakness on one side of the body. And that has to do with how the brain is organized. And typically when stroke symptoms occur, it affects one side, not both.
Mm-hmm.
Sometimes it can cause numbness on one side of the body. That's less common, and there are a lot of things that cause numbness, but if you feel numbness in your face and your arm at the same time, yeah, that could be a stroke. You need to come in. And you can cause trouble speaking because you're having trouble expressing yourself clearly, your speech is slurred, or because you're having trouble thinking of words or having trouble understanding words, depending on where the stroke is. And different parts of the brain have different jobs. If the stroke is in a part of the brain that controls language, you might be speaking clearly, but saying words that don't make sense. Stroke can affect vision. So loss of vision on one side of space is a stroke sign, and that isn't often appreciated by the patient. Often it's somebody else who notices that they're having trouble, they bump into things. Patients will say they just feel like their vision is blurry. Those are key hallmark signs. Lastly, sudden, very severe headache could be a stroke. A headache, worst of your life, unlike anything you ever experienced, is a medical emergency until proven otherwise.
And doctor, are these symptoms different for men and women?
So the symptoms are the same, but men and women experience life differently and express themselves differently. And we've noticed with heart attack that women have been less likely to get treated early than men. That this is a bias on the part of doctors and sometimes a bias on the part of the patient. It's like, I couldn't have a heart attack, I'm a woman. Well, stroke can affect everyone, men and women, and it's an equal opportunity disaster. We don't like people to have strokes, but when they do, whether you're a man or a woman, the number one job, if you think it might be a stroke, call 911 and get to the emergency department immediately. The thing about stroke that really matters and that a lot of people don't know is we can turn it around if you get in fast enough. But as the clock ticks along, our opportunity to try to make the stroke better and turn things around starts to fade. So we really, really, really want people to make a guess. If they think it's a stroke, not sure, maybe it's just one of those other things, call 911. You don't call your mom, you don't call your sister, you call 911. The ambulance will call us on the way. We will be waiting for you. when you arrive.
Yes. And doctor, what types of stroke treatments does Montefiore's Comprehensive Center for Stroke Care provide for patients?
So we are, as a Joint Commission certified super duper comprehensive stroke center, capable of providing the full gamut of care, including experimental treatments for people who opt for that. We are perhaps by far the biggest intervention that we do, the one that's most exciting for me as a stroke doctor, is when somebody comes in with a big blockage and a severe stroke, we can reach up into the head using a catheter that we put in the leg, feed a little tube up into the head, and pull the clot out. And the next day, the patient has gone from being unable to move one side and unable to speak to complaining that the coffee is cold and he didn't like breakfast. So that kind of turnaround we see from time to time. It's not a guarantee.
Right.
We give it our best, and we can more than double the chance of a good recovery with that treatment. In addition, for the past 20 years, we've been giving a clot buster called TPA. That has to be delivered within 4.5 hours of onset of symptoms. It's super fast treatment, and we are in a rush to do it, which is why you need to call 911 if you think you're having a stroke, because we'll give you a clot buster if we can. The clot buster breaks up the clot that's causing the blockage. And sometimes, yeah, same story. The patient says, "Oh, doctor, I feel better." Sometimes, though, this problem, as I said, isn't blockage, but bleeding. And there we have neurosurgeons who specialize in stroke. They can pull clots out of your head, but they can also remove hemorrhages. And sometimes, if the stroke is really severe, we have to do more surgery than that. These are things that are only available at a comprehensive stroke center. Other centers don't have it. They transfer patients to us to get that kind of care.
Right. Thank you, doctor. Now, according to the American Heart Association, strokes are the number 5 cause of death in the U.S. Doctor, why is it important to catch strokes early, and how has the pandemic affected this early detection?
Well, that's two big questions. Number one, stroke, yeah, it's the 5th leading cause of death. And you might think, gosh, doctor, can't you do better? And I have to say, well, we used to be number 3. We have done better. And a big part of that is risk factor reduction. We are so much better at controlling blood pressure, and people are more aware now, and we're not doing it enough. But if you can keep your blood pressure down, if you can take care of your diabetes, if you take the pills your doctor prescribes, and if there's a problem with paying for them, get help, make sure you can get your pills, this risk of stroke is reduced by 70%. So, number one, you don't want me as your doctor. Prevent the stroke. But if it happens, the thrombectomy treatment we do, the TPA treatment we do, saves lives. So I have an exciting job. The COVID pandemic was a catastrophe for all of us. And, taking care of COVID patients, I got COVID. It's no joke. So, first of all, COVID is a nasty, very nasty, bad bug. The vaccine, I got that too. Absolutely worth it. Do everything you can to get it as fast as you can. The vaccine is key. It made my arm sore and I had a fever for a day. I did not like the vaccine, but boy, you want it. You do not want to catch COVID because COVID can cause stroke.
Yeah.
Now, I do have one more thing to say, and that is when the pandemic hit us, everybody was afraid to come to the hospital. And we had patients with bad strokes staying home. The number of patients who came in with stroke dropped by up to 40% during the peak pandemic time back in March and April 2020. Where were those stroke patients?
Wow.
The strokes were still happening. They were staying home. And they weren't getting the care they needed. And we paid a very heavy price. It wasn't just the COVID, it was the lack of stroke care. And that affected people with heart attack too. People were afraid of the hospital. So here's the message. We figured COVID out. We have vaccines. We have procedures in the hospital. We will keep you safe.
And doctor, as a follow-up question regarding COVID, are viruses like COVID-19 associated with a higher risk of stroke? If so, how and why?
Yes, and COVID that causes so many problems. One of the things it can do when you have a severe infection is increase the chance of blood clots forming anywhere in the body. They can form in the veins and block drainage of blood from the leg. That can be very serious. Or they can form a blood clot in the heart. And that blood clot doesn't want to stay in the heart. It gets pumped out. And it could get pumped out to the head. Or the blood clot could form in an artery in the head. That will cause a stroke. So we saw some very severe strokes that were complications of a COVID virus infection. First thing is to avoid it, get your vaccine. Second thing is, if you get COVID, get treated. We have things we can do. Montefiore specializes in it. There's a lot more than just staying home and hydrating.
Thank you so much, Dr. Labovitz, for joining us. We've run out of time, but how can we find out more information and contact Montefiore's Comprehensive Center for Stroke Care and, just stay informed on stroke care?
Yes. So I think the best way to do it is start with our website. We are always eager to have inquiries. We answer stroke questions. We take care of anybody who's had a stroke, and we're eager to help. I want everybody to stay safe, and please don't be afraid. If you think it's a stroke, call 911.
Thank you so much, Dr. Labovitz, for joining us today.
Thank you. Bye-bye now.
That's all for our show today. I'm your host, Sonyi Lopez, wishing you and yours safety and wellness now and always. See you next time here on OpenBXRX Tuesday.